Hi everyone. So my name's Charlotte. I'm going to be running the AC interview seminar today with my friend Mac. We might start in a minute or two to let everyone just get onto the seminar. So hold tight and we'll start in a sec.
Sounds good.
Okay, so we might just get started now in the interest of time. So we'll go to the next slide.
Getting there.
It's all good. So a brief overview of what we're going to cover today. So Mac and I had both interviewed at a bunch of different medical schools, so we'll be able to run you through some of the more New South Wales specific ones. But bear in mind that it's a bit of a weird year with COVID, and a lot of the unis have changed the way that they run their interviews. So we'll talk a little bit about like online interview strategies, but just bear in mind that a lot of the things that we say are from personal experience and on experiences of people in years gone by. So things might be a little bit different this year. So just like take it on board, be adaptable. So we'll talk through the different types of interviews that they use to select people for entrance into medical school. We'll talk about what they're looking for in the ideal candidate. We'll talk about different question types again. We'll look at some different formats. We'll give you some tips about prep, and then we'll wrap up at the end with a quick summary. And in this, we're also going to do a couple of practice questions as well that you guys can follow along with.
Cool.
Sweet. So do you want to go first, Mac?
Yeah, sure. So my name's Mackenzie, but you can call me Mac, and I'm in my second year at UCID. So I interviewed in, I guess, for 2019 entry. Yeah.
Yep. I'm Charlotte. I'm a third year at UCID, and we're both at the same clinical school, which is kind of funny.
Yeah, Westmead.
And I interviewed at UCID and Melbourne, and I did that in my third year of undergrad in like 2017. Cool.
Awesome.
So basically, like the interview is their way of sussing out who they actually want in their program and who they don't want in their program. Because for a lot of schools, and especially a lot of the schools that only take GAMSAT, like you said, is that you get a lot of people sitting on really similar scores. So if you think about like the GAMSAT percentile curve, between like a score of 68, 69, and 70, you'll have about like 300 or 400 people. So the interview is like a big differentiating tool that the unis use, and it's your chance to really make yourself stand out from the crowd. It's weighted significantly in the final selection process. At some unis, this is like 30%, where it's like a third GPA, a third GAMSAT, and third interview. But for most unis, it's 50% of your overall score. So it's really important to make sure that you're well prepared for it. There are a couple of different types of interviews, and some unis like ANU use a combination of both, where you can have an MMI, you can sit in front of a panel of a few people, and you can also do a group interview. So we'll go into this in a little bit more detail later on.
I just wanted to say, I think it's interesting how much people prepare for the GAMSAT, but then it's like in the end worth a similar amount to the interview, and people don't spend nearly as much time preparing.
Yeah, for sure.
So it's
like some people just kind of assume that because they're like a nice person that they can wing it and they'll get in, but like on the whole, that's most people, hopefully.
Yeah.
It's important to prepare.
Yeah. Cool.
So MMIs is probably like the most common type of interview that they use. And this basically consists of you rotating through 5 to 10 stations. Before COVID, this kind of meant that you went from like one little room into another little room and you rotated around like a hallway. But with online interviews, that might be a little bit different, and you might have different examiners, or maybe like the same examiner running you through things. We're not really sure how it's going to work. But the gist of it is that at each different station, you'll be given a short scenario or a prompt or a question, and you'll be given about like 5 to 8 minutes, depending on the university, to answer this. There are sometimes follow-up questions, this initial prompt, so you want to make sure that you've got your timing okay. And you're scored based on the appropriateness of your response to whatever stimuli they've given you. So this may not necessarily be just an ethical scenario. They could ask you like, why do you want to be a doctor? Tell me about like a time you failed. I quite like MMI forms of interviews because if you do perform poorly in one station, this doesn't really affect your score in the other station because the examiners don't know how you've gone in other rooms. And you can draw a line under it and move on and go to the next one. You will vibe with some people, you won't vibe with other people, and it's important to just like collect yourself after each station is over. And also like it can be fun if you look past the stress. And I think that this is a really important point that everyone kind of forgets. But honestly, like thinking about the ethics and like talking through things, it can be quite interesting. And it's important to just like relax. And I think be happy. Well, it's going to sound kind of hard to say, but it's important to like be happy as you're doing it, because I think that really reflects in like your answers and the way that you present yourself if you're at ease and being bubbly. So it's a good tip.
Yeah, if you like turn that like nervous energy into just like excitement rather than like anxiety somehow.
Yeah, for sure.
I like obviously did the MMI at UCID, and I thought it was really interesting because like the stations I thought I did bad on in reflection were interviewers that were kind of playing like the hard guy, like they were not giving me any emotional response, or like they weren't like giving me any positive feedback, like with their body language.
Yeah.
And then you realize that the interviewer themselves like makes you feel a certain way, and that was probably intentional.
Yeah, we'll go into those tips in a little bit, but that's definitely something to look out for.
Yeah, cool.
Because they play tricks on you. We'll go to the next one.
Yep.
So next one is a panel interview, which probably isn't going to happen this year, as a word of warning. And not all unis use this. It used to be a lot more common than it is. But basically you sit down in a panel in front of like 2 to 4 people. I think usually there are about 3. And they just give you a series of questions and scenarios, and you have to answer these. Generally what happens is that they'll have like one examiner trying to be bad cop and grill you, and then another examiner who's a bit nicer. And then sometimes I'll have the third person doing something a bit weird, like looking disengaged or like staring at you in like a funny way, just trying to throw you off. So it's important with these types of panels because you essentially have control over where the conversation goes, is to make sure that you engage all 3 examiners equally, because they'll probably be looking for you to engage more with one person based on their body language towards you. And also you need to think through your answers a little bit more, because if you say something that's a bit questionable or a bit of a throwaway, in an MMI, the examiner doesn't really have the opportunity to follow you up and chase you up on your answers because they already have the prompt set out for them. A panel is quite different because if you do say something like that, the examiners can say, hold on, can you explain that in a little bit more detail? Or what did you mean by this? So you want to make sure that you're thinking through your answers a little bit more, because they do have the opportunity to go in depth in a bunch of different things. So we can probably go to the next one now. And then a group interview, again, like this one's quite common at ANU. And it used to be common at Notre Dame, but I think they're moving away from that. And this year, I don't think that group interviews are going to be a feature of the process. But basically what happens is that it's a small group of students being interviewed together. And a lot of the time, it's like you'll have to come up with a novel solution to like a public health crisis, or you'll be asked to problem solve a task. So the scores are based on your ability to work as a team member. And the reason why they make people do this is because medicine is incredibly team-based. So it's an important trait to have to be able to work as part of a team. They'll grade you on your professionalism, your problem solving, and your lateral thinking. And I guess with group interviews, one of the more important things to do is to be able to find that balance between showing off what's good about you and your good ideas, and then also acting as part of a team and not completely shadowing out everyone else. So you want to make sure you're not being obnoxious, but that you are like showcasing yourself to the best of your abilities. And you just make sure, like, be nice to other people. Like, don't be that group member that we all know from undergrad, pretty much.
Did you want to say something about the motivation statement here?
No. We might move on because I think that
Okay.
Will come later.
Yeah.
So for UCID, I think as you all know, they've already released their offers because they didn't actually interview people this year. When we did our research for this, we found out that Notre Dame hasn't really released any information either, so we can't help you with this as much as we would normally like. For the University of Wollongong, they've already stated that they're trying to do their admissions process as much as possible to reflect the way that they normally do them. But this is probably going to involve online interviews, so either via Zoom or by their own kind of software. And they've said that the examiners that they have are going to be trained in doing online interviews. So I don't think that you need to worry too much about being caught in like a technical bubble, because I think the university will try to work it out, but we can't really confirm or deny that. And then the bit about saying interviewees are rated on personal qualities, including their communication skills, empathetic and ethical approaches, reflective manner, teamwork, leadership, and decision-making skills. Like, we already kind of knew that, and none of that's different. But we do acknowledge that they haven't released their interview offers yet, and this can be quite stressful. So if you are waiting on a Wollongong one, just hang in there. And I didn't personally interview at Wollongong, but I had a couple of friends who did. And generally, they tend to have a higher amount of stations than other unis such as like Melbourne or Sydney. So it's really important for MMIs to be able to move on from poor responses, because if you do an interview with like 10 stations, it's kind of inevitable that like one or two of those are going to feel a bit iffy, and you don't want to get discouraged or disheartened and then find the rest of the interview really challenging because of that. So remember to take a deep breath and just move on.
Moving on.
Do you want to talk about
if you're ready? Yeah, was that it for Wollongong?
Yeah, that's it for Wollongong.
Basically, sadly for ANU, they haven't put out any specific info about how they're adapting to COVID. So we just the same deal as usual, where your interview, I think, how much is the interview worth at ANU? I think it's 50%, like once you get it.
Yeah, I think it's like 50% of your final overall ranking. So I think it's like 25% GPA, 25% GAMSAT, and then 50% interview.
Yeah. But I guess you'll just have to stay tuned to find out about how exactly they're going to run that. Yeah, so here's a big summary.
Yeah, so you guys can take a screenshot of this because we probably won't talk through all of it because there's a lot, and a lot of it's different this year. But basically, the ethical scenarios are common to all unis, so it's really important to be across these. And also for why medicine, that's really important as well, because with that question, it can be a little bit generic sometimes, and we'll go into it in a little bit more detail later, but you can sort of pre-prepare that one. And then health knowledge as well, which we'll go into, and the behavioral questions, which are similar to the ethical scenarios. So it's important to just be able to like analyze scenarios properly, which we'll run through with you later. And I think with the practical tasks, it's probably not going to be as much of a feature this year either. So take a screenshot of this if you're interested. I think it's also on the GradReady website, but we'll move on. So when you think about going into an interview, you need to think about like what the universities are looking for in like their best case candidate. And you want to try emulate those qualities. So if we click through some of these, we'll talk through what it actually means in real life, because I'm pretty sure some of you have already kind of generated a list in your heads. But medicine, like I said before, is very, very team-based. So one of the things that universities are looking for is someone who is a team player and works well with others, because they're trying to think like, which one of these students or 3 students in front of me is going to make the best doctor? And part of that will be like, which one of them has the greatest capacity to work as part of a team? And even if you don't have a group interview, you can still kind of like convey those qualities by talking through hypotheticals or the way that you act towards other people. The second thing is in being a good communicator. So I'm sure you all know medicine involves talking to a lot of people. Part of that is patient interaction, part of that is doctor interaction. You also have to coordinate with allied health. And if you don't communicate well, either conveying information about patients or conveying information about like certain tasks. And also when you're unhappy or when you feel out of depth, you're not going to be the type of candidate they look for. So they want someone who can effectively communicate their feelings as well as like structured information about other people. The next thing is to be culturally sensitive. So this is really, really important for medicine in general and also just in life. So Australia is incredibly multicultural. And if you have the fortune of working somewhere like Westmead, you're going to see people who are from like a variety of different cultures from all around the world. And a lot of these people are generally new migrants to the country. And sometimes it is difficult if there are language barriers or cultural barriers. But your duty as a doctor is to be able to overcome these and still provide these people with the best possible care. So that's really important to remember, and you should try to emulate that as much as possible in your interview.
Can I just add about that? I think like the way that you can kind of get that across is by showing an understanding that there are worldviews other than your own, and also like showing that you know that those are valid as well, even though you don't necessarily, that's not how you feel. Just acknowledging different viewpoints.
Yeah, for sure. And then it's also important, and this is easier said than done, to be effective and competent. So part of that as well in terms of competency is to remember your role. So when you're interviewing for medical school, you're not a medical student and you're not a doctor. You just have to try be like the most competent version of yourself. And part of that is going to be acknowledging like the situations that you can do things in, the situations that you can't do things in, and just like acting sensibly, I think is the biggest thing in terms of competency at this stage. Next one is being able to deal with emotionally complex situations. So this is really important as well, because a lot of the ethical scenarios will try to bring out those emotions inside you, and they'll also deal with quite heavy topics. And it's really important to first and foremost act out of empathy towards other people in terms of like making sure that emotionally they're okay, looking out for their safety, and acting in a way that makes it clear to the examiner that you do consider other people in your actions. And this doesn't necessarily mean that you always have to prioritize other people above yourself or like prioritize people above certain actions, but you need to be able to talk through why you're doing things and make sure that you're showing that you're actually actively considering the viewpoints of others and the impact and the consequences that your actions will have on other people as well.
Yeah, on that note, like I got some really good advice for my interview, was like always put empathy before like logic or that kind of thing. Like always present yourself as like focus on that like empathy aspect rather than anything else if you're wondering where to start.
I think that's a really good tip.
Because I was like, I think I'm probably a reasonably empathetic person, but I was like told that I was coming across as like quite cold because I was trying to be like, okay, well, this and this and this, like trying to like be really complex about it.
There's a real art to it, I think.
Yeah.
So basically, like when you do get an interview question, you need to be able to do all those things at once, which is hard initially, but as you practice, it gets a lot easier. So prepare. Go to the next slide. So do's and don'ts. So some of these are explanatory, some of these aren't. We'll go through the do's first. So number one, dress appropriately. What I found is that a lot of people tended to dress very, very formally for their interviews. I kind of dress halfway in the middle, but basically like a good rule of thumb is something that's like smart casual, but ultimately that you're comfortable in. So if you're a girl, don't feel like you need to like wear heels and a really, really like super formal suit. If you're a boy, you don't need to wear a suit either. Just make sure that you're like tidy, polite, you're dressed for the occasion like you would be like, I don't know, meeting someone who's a bit older and like more conservative, I think is like a good rule of thumb, because the examiners do tend to be a bit older and sometimes it's good to just keep that in mind. The other thing is to introduce yourself professionally to the interviewers. Some people will go in for a handshake, other people won't. It's all online, so you guys don't even need to worry about that. If you're doing online things, it might be a good thing to do like a wave or something because it makes you seem a little bit more human. But just like be polite and say, hi, my name's Charlotte, like pleasure to meet you, or something like that. You don't really need to be too over the top. It's important to articulate yourself well, and I'm saying this as I'm umming and ahhing my way through this entire presentation, but make sure that you pick up on your verbal tics. So everyone has them. My one was I used to gesticulate a lot and drop a lot of likes, and everyone does it, but in the interview, you just want to make sure that you're not doing that. So make yourself aware of it. And the next thing is to approach the question using a framework. So we'll go through frameworks later, but it's really important that when you're standing in the corridor or like you've got the prompt on Zoom and you've got the 2 minutes to think about it, is to collect your thoughts and actually come up with like a strategy. Because I think one of the worst things that people do in interviews and in essays and just in life in general is rush into things without thinking about it properly. So you want to have a think about how you're going to approach this, the type of things you want to say, and that'll kind of ground you in the question before you start talking. And that's super important. If we're thinking about the don'ts, the first one is avoid gesticulation. So this might be a little bit easier because you guys are doing virtual interviews, but it can be quite distracting and can sometimes make you seem excessively nervous. So one thing that I used to do when I found myself doing it is I just used to like hold my hands together in my lap so that I wouldn't be tempted to like start doing this kind of thing. Like I said before, don't launch into the scenario without thinking first because you'll probably fall into a little trick. The other one is don't go for the water if you're shaking because you're going to pour it all over yourself. And the other thing is don't really try to memorize responses to particular questions. Like there are some which you can like pre-prepare for and have like a general idea, but you shouldn't ever memorize anything word for word. Do you have anything to add?
Just on that last point, I do remember there was one or two questions, and obviously we can't like disclose specifics, but that I had seen pretty much the exact same question before on one of the paging doctor documents. And so that was when I set my interview. So that was like good because I'd actually done it before. But like a few of the questions they came up with, like there's no way that anyone could have like predicted what they were going to ask. Like they were just very random.
Yeah, exactly. That's why it's important to develop like the tools rather than memorizing all the lists.
Yeah. Memorizing is for later in med school.
You have a lot of time for that.
Yeah. I guess, sorry, were you ready to move on?
Oh, yeah, we can move on.
Cool.
So for ethical scenarios, these are going to cover like a really wide range of things. They're not always going to be medical based. So a lot of them are set contextually outside of the hospital, more in life situations. And these can be quite hard to approach because a lot of the time they're overwhelming and there's not really like a correct answer, but that's kind of the point. And you have to talk through that and be like, well, if this happened, I consider doing this. But if we think about like the perspective of person A, maybe this would be better. And like through the response, you just kind of rationalize a plan of action that show that you can consider like ethical constraints and also the needs of other people. Next one is motivation to study medicine. So this is a classic, why do you want to be a doctor? Try not to say super generic things like, I want to be a doctor to help people. I want to be a doctor because I like science. I want to be a doctor for blah, blah, blah. Come up with the actual reason that you want to do medicine. Don't say money, don't say power. Don't say like people do say it. And it's back because in my mind, I'm always like, surely someone has said this to you that this is not a good idea. But like, just think about the reasons why you actually want to do it. And you will come up with something that's like unique and genuine to yourself. And that's going to be better than any other pre-prepared reason or stealing someone else's idea. Like when I taught the Interview Ready course last year, I went through like my own response to this question as an example. And then when we did the mock exam, like a week later, all 15 candidates just kind of repeated my own answer back to me. And I was like, it's all telling me why I want to do medicine. Like, I know why I want to do medicine. I want to know about why you want to do medicine. So it becomes really obvious if you don't have something that's like genuine to yourself. So have a think about that.
Some deep introspection.
Yeah, it's always fun. We've all got time in quarantine to do that.
Yeah.
The next one are DTEC questions. We probably won't go into a lot of detail about these ones. If you do want detail on these ones, you should go watch the AC interview for Melbourne because these questions are only really used at Melbourne Uni and even they don't use them every year. But basically they'll just give you like a scientific word and you have to explain it to someone who's never done science before. And then the health knowledge ones. Again, these ones are a little bit more specific to Victorian universities. But basically these questions just kind of test your understanding of health issues in Australia. So a good way to approach these questions is pretty easy. Read the news, try to like inform yourself of what's going on. Maybe there'll be a pandemic question, we don't know. But basically just try to inform yourself about like how the Australian healthcare system works, like what systems are in place and what are some of the issues surrounding these.
Yeah, and I guess maybe some like areas of interest could be like women's health and like what's happening with abortion or like Indigenous health or refugee health. I feel like areas like that might be like things that are A, interesting to learn about and B, could come up.
Yeah, for sure. Next slide. Behavioural questions are kind of like, I kind of interpreted these the same as ethical scenarios because they're kind of like either what are the issues or what would you do? So with this one, a good way to break it down is to examine the situation, then think about the task that's in front of you. So what would you do? Think about your action. But then the important thing that everyone forgets to talk about is like, how are your actions going to impact on other people? What is going to be the response to your action? And what are ways in which you can like measure the actual response to your action? I think is important. So we'll go through that a little bit later, but that's a good framework. Then the next one is practical tasks and puzzles. Again, there's a huge variety in this. It's probably not going to happen this year because of COVID, unless you have to instruct someone over Zoom, but I can't really imagine that that'd happen. So just make sure that you don't get impatient with the person who you're trying to teach is my advice, because a lot of the time they'll be purposely obstructive to try trigger the people who get very frustrated very easily. So take a deep breath and just be patient is my advice. For the next one, group work. So someone's asked a question on Facebook saying, does everyone get a chance to answer the question for a group interview? So for a group interview or for a group work, they'll probably have some kind of framework to allow people to answer some part of it individually. Otherwise, if there isn't, you just need to take the initiative and make sure that you're speaking up and not letting yourself be shy and like fall to the back of your group. Okay, but at the same time, don't be overbearing. But again, may not happen this year because you can't be in a room with like that many people. So we'll talk through some example questions, and this will probably take us to the end of the session. So this question is a really good example of an ethical scenario. So a friend has told you that she's pregnant and that she hasn't told anyone else and will possibly seek a termination. One day in class, she becomes unwell and your tutor asks you if she's pregnant. What do you respond? So do you want to take this one away, Mac?
Yeah, sure. I actually thought that we were going to have like student participation, so I thought people would come up with the list of issues. But let's just talk through this. So my first piece of advice is you'll read this, and in the context of an MMI, you have like 6 minutes to answer the question, and you might have like a minute or two to read the question before. And it feels a bit strange to like sit there in front of someone and not immediately start talking to them, to just kind of sit there blankly while you think. But I would, like, as Charlotte mentioned before, encourage you to do that.
Yeah, and it's really important.
And it's also kind of up to you to make sure that you get through all the questions. It's probably not essential that you do, but like if you just speak for 6 minutes on the first question, that will miss out on insights you might have for the future ones. So like what I would say for what issues are involved in this situation, the way I would think about this is think about all the different stakeholders. So first of all, you think about your friend, and she is probably the most important stakeholder in this situation. And what are her concerns? And so basically everything to do with her. So why hasn't she told anyone else? And like, I guess it's a big like personal decision for her if she's seeking a termination. Is she supported in that decision? Are you able to help with that support? And then you think about the tutor, and you're like, why is the tutor asking if she's pregnant? That, like, without more context, that seems extremely strange. And I guess that might be raise an issue there. It's also probably, if it's just completely out of context, or like if it is relevant to the medical case, then you have the issue of like, what should you say to the tutor? And that comes up in the next question when you start think when they give you, if a paramedic attending to her asks if she's pregnant, do you tell him? I think it's reasonable to ask for more information if you feel like you can't quite make the call with what they've given you. Like, I guess in this context, I'd probably want to know like how unwell she is, because in general, I feel like you should favor autonomy of people and their right to confidentiality, and to not to confidentiality. And it's her decision at this point, and she's not told anybody else. That's important to maintain that. But at the same time, if she's like, at like urgent medical risk, it's likely that you should. Do you have any thoughts about that?
I think that's pretty true. Like all of that good is a good analysis of this situation. I think that it is really important to recognize the roles of everyone, like Max said. And unless you have like a weird kind of relationship with your tutor, it's a bit odd for them to be asking if someone's pregnant out of the blue. And I think as well, like if they are asking about a student's welfare, like maybe the student isn't as engaged in her classes as she normally is, or maybe she like has been looking up stuff, like you don't really know. So it's important to just like acknowledge the fact that you'd want more information before addressing it as well. But it is asking you to make a lot of assumptions, and I think that the priority really is like the confidentiality and respecting the trust that your friend has put in you as well. And I think the other thing too to consider is that if your friend hasn't told anyone else that she's pregnant, it might be because she feels like a fair bit of like personal turmoil about this potentially, or it just might be really early. So you just want to make sure that you'd be thinking of the safety of your friend, and that you're like just checking that she's okay, and like maybe counseling her to seek proper like medical advice from like a GP or a counselor or something like that. So the next one is a paramedic attending to her asks you if she is pregnant. Do you tell him? So that's kind of like an escalation in the scenario, because it's gone from your tutor asking to paramedics being in the room, and you're like, what's happening? I think this one really needs you to talk about a lot of the hypotheticals. So if your friend is comatose on the floor, like the paramedic's asking, is there anything important I need to know about? Then you can probably break confidentiality and tell him she is like maybe in the early stages of pregnancy. I don't really know. But if your friend is awake, she's sound of mind, she's completely okay to make her own medical decisions, and she hasn't disclosed that she's pregnant yet, you shouldn't then go behind her back and tell the paramedic, is basically how this scenario should run. And obviously there are specifics that you need to talk about, but it really just boils down to under what circumstances do you break the trust that your friend has put in you. And it's only if she can't make her own decisions in whatever mindset that she's in, pretty much.
Yeah, so that was like similar to my thought. And like you explore that further in the next stop point of the girl's mother calls you the day after the incident and asks if her daughter is pregnant. I guess one thing that we have learned in med is just totally blanked on what we learned. So like you basically like you would only break confidentiality if the person was at an immediate harm to themselves or others. So that could also help guide you in your answers for these two middle ones. Like if you thought that if you were really concerned about your friend's well-being and you thought that her mother could help that situation, it would be reasonable to say something to her. But otherwise, confidentiality and like autonomy of your friend is key.
Yeah, and I think like with these scenarios in general, and when they're asking about like what you would do in a relationship between two people, it's really important that you act more as a facilitator, if that makes sense. Like you want people to have the most supportive, like best relationships for each other, obviously, but you shouldn't necessarily like be shoving people together and making them talk about things. You should be like encouraging and empowering people to make those decisions themselves. And like taking a step back sometimes I think is good too.
Yeah, that feeds in well to the last part here, where it's basically like you just want to basically support people to do what they need to do. And so that would be like guide how I would answer that one. Definitely don't say that you would defriend her.
Yeah, and definitely just don't be like straight away, I'd tell the mom, like she's a right to know, because that's also bad. But
I think if you never just say yes or no.
All of these questions are meant to sit in the gray zone, so you need to identify that and acknowledge that, I think.
Yeah.
So then the next one is the girl has decided upon a termination. How do you respond to her? So I think like when we think back to the ideal medical candidate, empathy is the most important thing. So I think it's really important to say that you would let your friend know that this must be a really hard decision, that whatever decision she makes is the right decision for her. There's no pressure, and that you just want to make sure that she's okay and that she feels supported. And I think that that is the best thing to say initially, because ultimately, like what you care about most in this scenario should be the well-being of your friend. And then once you've kind of acknowledged that, you can then go on to exploring like the intricacies of it a little bit. So then you could say like, maybe I just want to make sure that she'd like considered all of her options properly and that she was like accessing information from the right kind of source.
Oh no, have we lost Charlotte?
So you'd like maybe mention family. And I think it's also important to make sure that you refer her or like tell her to seek like advice from a GP or from a psychologist or from like someone who has proper training, because in this scenario you're only a friend and there's only so much you can do. And I think for things that are objectively quite heavy, potentially distressing events such as like a termination of a pregnancy or losing a family member in some scenarios, or someone dealing with like substance abuse, it's really important to recognize the fact that you don't need to solve their problems, but you should empower them to find people who can help in a professional capacity. And I think that that's really important too. And then you can like offer to help out in other ways. But I think that's the crux of it.
One other random point is like, maybe if you had extra time, just like make sure that, because the scenario is a little bit sus and she hasn't told anyone else and the tutor's a bit weird, you could maybe say that you want to make sure she's not being coerced.
Yeah, for sure.
There's always like different random things that are okay. And like, I think everyone going into the interview, you should just say what genuinely, it comes to you.
Yeah. So with this one, what do you intend to do if you do not get accepted into medicine this year? This is a hard question, and they ask it a lot apparently. Like I did this same talk with Elliot earlier on the week, and he was like, yeah, they asked me this at my interview and then I didn't get in, and he was like, oh.
Well, at least you had a plan then.
Yeah, and I think it's important to recognize that they ask this of everyone. It doesn't necessarily mean that you've flunked your interview, but I think like it's quite important to just be honest about what you do. So like for me personally, if I didn't get in, I was going to take a year off and like live my life a bit. But you can say that to the examiners, but you should frame it in a way that shows that you're thinking about it in like a self-development kind of sense. So you can just be like, yeah, I did my undergrad and now like I really want to go traveling and see the world. And I think that this is going to make me like a better person in these kinds of ways. Or I think that I would find this really personally fulfilling for like XYZ. If you love research and you want to do honors, you should say that. But ultimately, I think that you need to kind of bring it around back to how whatever you do in the next year is going to equip you like better for medicine, and that your answer isn't, I'm just going to give up and go into corporate finance or whatever, because I think that's kind of like the worst thing that you could say. Yeah. Do you have anything to add, Mac?
I guess like the big red flag not to say would probably, don't say that you're not going to try to get into medicine again. Like, just don't say that.
Because you need to show resilience as well. Like, no one ever talks to you about this before you get into med, which I felt a little bit betrayed by. But once you do get in, there are a lot of medical students for not very many jobs. So the chances that you are going to get rejected from jobs and get rejected out of interviews and experience personal failure for things which are really important in the future is really, really high. And it's important to be able to have backups, and have backups that are like genuine backups, that you're not just going to mong around at home and cry for the next year. Like, you are going to have setbacks, and it's important to convey to the examiners that you are a resilient person who can cope with setbacks as well.
So I guess like not making out like it's going to be a huge deal if you don't get in. Like that's pretty normal experience to have.
And I think as well with this type of question, it's like also normal to acknowledge the fact that it'd be disappointing and that you would be upset about it, because sometimes people swing too far the wrong way and then they're like, I would just take it in my stride and do like XYZ. And like 99% of people, if they get rejected from something that they want, are going to feel sad for a bit. And you can say that to them and just be like, yeah, I'd find it really difficult, but like ultimately I'd find this other thing fulfilling, but like hopefully I'd be able to come around and reapply and like get to where I want to be. Yeah, don't be afraid to like get
real.
Yeah, exactly, because it just shows that you're a normal person, which is never a bad thing, I think, especially even in medicine. Once you're in, when you're talking to patients, you just want to like, at the end of the day, kind of just relate to people, which I think is important and something which isn't really valued as much as it should be. Do you want to move on?
Yep.
With the DTech, I'll just talk about this quickly because I interviewed at Melbourne, which is the uni that only does this. And I was actually interviewed in the 1 year that they didn't do this, which was a blessing for me because I hated these questions. Because like, if you're applying to medicine, chances are that you familiarize yourself with some form of science from GAMSAT or from your science degree or from high school science or just from like knowledge. And it can be really, really hard if you're someone like me who did science all through high school, who did science for their undergrad and then it's applying to med. And I also had parents who were like scientifically literate and spoke about a lot of things at home, to then take a step back and have to explain to someone what like a cell is or what an atom is or what like electricity is, because they're kind of things that you just take for granted. So if you are preparing for Melbourne interviews, the best thing that I can recommend is finding someone, find that friend who you had in high school who did no science, who hated maths, or find like your elderly grandma who may not necessarily like be super scientifically literate, which is what I did, and just like test out your explanations and analogies on them. Because if you practice sometimes with people who are from similar backgrounds to you, they won't necessarily pick up on the fact that you're not making sense to someone who has absolutely no knowledge, which is important. Finding analogies at work is really important for this one. You have creative license. But the best thing to do with these types of questions, and similarly, if you do get a question that asks you to engage more with the examiner and be like, explain this, or like teach them how to do this, one of the things that you should check post your answer with is asking them, do you understand? Like, are you following along? Is there anything you would like me to clarify? And just making sure that they actually like get what you're saying, because it sounds like cheating if it's a DTech, but that's like one of the most important things about teaching, is not like finishing an hour-long lecture and then realizing no one understood a word of what you were saying because you didn't explain something properly in the first 5 minutes. So
that's a really, it's a really good point.
Yeah.
Yeah.
We'll move on. So health knowledge. So if some of you follow the news, this is an important one because closing the gap has been in the news a lot lately because they've renewed the goals. And similarly, like a lot of these things will be pulled from headlines or things that are topical. So when I got asked a health knowledge question, it was about the NDIS, which was being funded that year through different schemes. So just make sure that you're like well informed. And I think like with these types of questions as well, if you don't really know anything about it, even though it might be really tempting, don't wing it, because there will be like 5 or 6 other people before you who will have known exactly what it is and given a perfect answer. And then when you are like, I think it's kind of like this, and don't acknowledge the fact that you don't know anything, it's going to be really obvious. So the best thing that you can do in this type of situation is to say to the examiner, like, look, I think I generally know what this is about. However, unfortunately, like, I'm sorry, but I don't know the specifics of it. And if I wanted to find out more, or if I was going to like look up things, this is how I would locate like a bunch of information. And these are the sources I'd use. And these are the types of questions I'd ask. And when you actually acknowledge the fact that you don't know things and then show that you have like the tools and the motivation to go look up things, that's kind of what they want. Because when you think about it, in like in medicine and in doctors, if you were a patient and you had this kind of like weird rare disease and your doctor didn't really know what they were doing, you would rather that they acknowledge the fact that they didn't really know a lot about your condition, went away, educated themselves, and came back to you with the right treatment, rather than pretending they knew what condition you had and then giving you the wrong thing. And that's like kind of what they're testing for. They want people who are humble enough and secure enough in themselves to acknowledge when they have gaps in their knowledge. Yeah, and then I think like the follow-up questions to these are generally like more ethical scenarios. So once you get over that first hurdle of like, what is this? They tend to be pretty smooth sailing from there on.
Nice, that's probably good to hear.
Yeah. Do you want to talk about this one, Mac?
Yeah, sure. So moving on to the behavioral questions, and these are going to ask you, I guess, how you would act in a certain situation, which is like the distinction maybe from the ethical scenarios where you have to think a bit more broadly. Behavioral is a bit more practical, and maybe they might ask you to pull examples from your life. And so this is an example about leadership, but some other like quite common behavioral themes would be like conflict resolution, or how did you deal with a stressful situation, or like how do you manage work-life balance, or like describe a time that you worked in a team and it went well or that it went badly. And I think those kinds of things are worth having to think about, to have a story that you can tell on hand. and a story that like maybe you will discuss with a friend or two and they can tell you how you come across. I recently was helping a friend for interviews for getting an internship, and basically just being like, I guess like the litmus test of like, do I sound like a dickhead here? And like, yeah, I think you want to have one story on hand for each of those things, and like peruse like the past questions from the uni that you're interviewing for. But those general things that I just said, I think are safe bets as well. And it's kind of nice to like survey your past life and think about stories that you can tell.
Yeah, for sure. And I think it's really important as well to like reflect on your performance and just be like, this is the last time I did it. And I think I did like these 3 really good things. But then I also recognize now when I look back on it that there are like a few things I could have done differently. And if I was in this situation again, I'd like try and incorporate those.
Yeah. So like some reflection on, so not just telling the story, but then some reflection on how you could change. Yeah.
Yeah. Because I think that like commitment to continuous personal growth is something that wasn't on the list of ideal medical candidates, but it's something that like if I was on the admissions board, it's like something that I would really, really emphasize too, because like once you get in, the learning just starts. And then once you start work, the learning starts again. And like you'll never really improve if you don't have that ability to take a step back and be like, well, that was shitty. Like, what am I going to do next time?
Yeah, the growth mindset.
Yeah. And you're not always going to have someone to point it out for you. So it kind of like relies on you being able to do that for yourself.
Yeah,
Growth mindset is the best mindset.
Yeah, Google growth mindset if you haven't looked at that yet.
It will change your life.
Yeah. We both like sat through the same lectures, I think. But genuinely, like it's genuinely a good way to think.
It makes you so happy because honestly, like I had a very rough beginning to 2020 before the pandemic. And then I would just like go in a bit zen and be like, this is making me a better person in these ways. And honestly, it makes you cope with things a lot better. So that's my life tip from this entire thing is growth mindset, is good mindset.
Yeah, not just interviews, just life. Let's just expand the scope of this seminar.
Let's move on.
Yeah, cool.
So with the practical task, I don't know if this is going to be in this interview cycle, but like I said before, they're going to purposely try to bring out your bad personality traits. And fortunately for me, my job before tutoring people in GAMSAT was tutoring a lot of very young high school children. So I was a master in patience before I started preparing for these, because once you've explained the quadratic formula to a 14-year-old for the 50th time that afternoon, we're also trying to like just be a 14-year-old boy, you like learn how to cope with people. But I think like the worst thing that you can do in these types of scenarios is be condescending, is to get frustrated when they're doing it wrong, or to get short with the person, or to be like, just like take a step back, be like, do you understand? Like, this is hard, I know. Sorry if my instructions like aren't the best, and just keep trying things until they work pretty much, because they'll like stop toying with you after a while and like actually do it properly, but they're just going to try push you to breaking limit in terms of like getting frustrated with someone. So it's important not to fall into that temptation. Yeah, but I don't think it's going to come up this year, to be honest.
Yeah. Sorry, just tech things. I'm not sure that I'm sharing the right screen anymore. Can you see the face?
Yeah, I can see it.
It's the right one.
Good.
Okay, cool. Yeah, don't have anything to add there. I guess like your aim isn't to get the person to do the task, like your aim is to convince the interviewers that you're a reasonable person.
Yeah, exactly. Show that you have empathy.
Yeah.
So with the group work again, unsure how this is going to work this year, to be honest. But again, like we've said before, just make sure that you're contributing a normal amount, that you're showing that you can work well as part of a team. I think it's really important for these ones, is that if you're in a group of like 4 people and someone comes up with an idea that you think is kind of just objectively a bit stupid or like dumb, don't say that to them, and don't be condescending and be like, oh, nice one. Because like you'll just look like a dick and that's not good. So if you want to suggest your own thing, it's important to acknowledge the merits of other people's work. And this is like getting people to like you 101, sorry. Is that when someone suggests something and you're like, no, that's a bad idea, you should be like, I really like this part of this. And I think that we should take what you said because it's really good and incorporate it into this other idea, which is kind of what I'm suggesting. And that way, you're engaging people in the process. You're acknowledging that what they've said is like good, it has value, but ultimately like it can be incorporated into something better, which I think is really important. Because if you just tell someone like, no, that sucks, they're not going to be very motivated to join in for the rest of it. And you're also going to look like a bad person because you said a mean thing. So don't do that in group work. The other important thing as well is to just make sure that everyone is engaged too, because I think the other thing that can be really bad is when like two people take direction and then the other two people are left kind of sitting out. So you want to make sure that everyone's participating, everyone's doing an equal amount of work, that everyone is like happy with the task you're doing and that you all kind of agree on the plan pretty much. And I think like honestly, like these ones are meant to be more of like the examiners kind of watch you all do it rather than you sit and answer questions together. So it's important to just like act towards other people in a very professional way as well. But again, just like be a normal human, like have jokes with people if you want, like albeit they should be professional jokes. It's always a hard line. Like I got asked to put on music for this patient procedure the other day and I was like, I need to put on something that's like PG because I don't want this like woman to be lying there and then for like music that has heaps of like swearing or like bad references up. Just like bear in mind your context and like adapt your behavior to it, but still don't be a freak is my word of advice with the group ones. But like it's probably not going to be a thing this year if we're being completely honest. So we might move on. So with online interviews can be quite difficult, especially if you're used to doing in-person interviews. So it's really, really important to practice. So pick out your spot for where you're going to do your interview. You want to make sure you have good lighting. If you're like me and you have one of those Dell laptops that has the webcam in the bottom left-hand corner, prop it up on some textbooks because it'll just save your neck and also stop that camera angle like coming up here. You want to make sure that your mic works. You want to make sure that the camera's clear. And you should just like do a Skype call with like a family member or a friend who you kind of trust. They can be like, no, that looks terrible. Or like, you've got a giant light behind you that kind of blocks out your face half the time because like that's not going to be good and you want to be like comfortable as well. The other thing is it sounds obvious, but you always forget when you're using your laptop. Make sure that you only have one like window active and mute your notifications because you don't want things popping up and like annoying you. And if you use your laptop every day, like you'll kind of forget to do that. And also close your door. So you don't want like your pets coming in. You don't want your mum coming in. You don't want your sister like banging down the door either. So just like put up a sign or something that goes like, I'm doing my med school interview. Like, can everyone be quiet and not interrupt me? And then if you do have like a home environment that's not necessarily compatible with that, if you're a uni student, like you can go book a room at like your local university library or like council library and just do it there because that way you've got like a guaranteed quiet space too. The other thing is to make sure that you sit up. You can choose to show how much you've like your body you want in the camera shot. Like maybe having it at an angle where you can kind of like see your hands might be good. So then you can do like hand gestures without like waving your hand too close to the camera. The other thing, which is really understated, but we all do it, is you need to make sure that you look into the webcam because I've realized now that when I'm in Zoom calls, I just sit there and stare at like the tiny little icon with my face in it being like, what do I look like? I can't believe I look like that when my head's turned that way. Like, is this what my head likes from this angle? And everyone does it because we're all vain humans, but it's not what you want to be doing during your interviews. So the tip that someone told me for online interviews is to print out a photo of a person, print out a photo of yourself, whatever, and just like stick it on the wall behind you or stick it like behind your webcam, because it's a lot easier to make eye contact with what you look as or what you're viewing as an actual person rather than like a tiny camera with a light next to it. So that's always like a good one to do. Do you have any other tips, Mac?
Even dragging the little window with your face in it right below the webcam, then it looks like you're looking at the other person, even if you're looking at yourself.
It's so true. It's so easy to forget about as well.
And like I'm so bad at this, like the posture thing. I just sit here like this because that's how I normally look at my laptop. But I think genuinely, like, just do not touch your face. It looks much better.
Yeah.
Especially because like with like the close up.
I did that. Like my webcam, like good. It sits down here, so then when you type, your fingers are like,
oh wow.
You want to correct that and make sure that you don't necessarily do that during the middle of your thing. So just be aware of where your webcam flaws are, is my advice.
Because it sucks that like people do judge you on stuff like this unconsciously as well as consciously. So just give yourself every advantage.
It's all about, honestly, like interviews are just about likability to a certain extent, and you just need to make sure that you're ticking those boxes, which is hard and sad, but So scoring, they will score you across 4 areas. Content is an obvious one. So if you talk a bunch of shit, you're going to get a bad mark. If you say a lot of insightful things, you'll get a good mark. Your structure is important as well, because even if you say a lot of good things, but it's word vomit, you won't get a good mark. So you just want to make sure that you're breaking down things in a really structured way and that it makes sense in your head. Empathy is really important. They won't necessarily have like an empathy box and ticket, but they'll have something kind of like that, or like qualities that we want things. So you just want to make sure that you're ticking those boxes, like we said before, and then also your presentation and your manner. So this is all about being professional, acting in a professional way, being polite, talking clearly, and just making sure that you are communicating effectively and in a way that is appropriate for the context.
That sounds good.
Yeah, and then so prep. Again, just do your research. Talk to previous students, Google things, find forums. Paging Doctor is quite a good resource for interviews. I didn't really like it for anything else because I thought that everyone on it was a little bit fear-mongering. But it's good to read through people's past experiences and like what people wore, how people felt it, which room did they go to. And then another thing as well is to practice your responses. The best thing to do for any interview is to sit there and record yourself answering a question, because I did that a few times. And then when I rewatched it, I was like, oh my God, this is terrible. But it made me really aware of like the things that I did, that I was just like, oh my God, Charlotte, why have you touched your face for the 50th time in like 30 seconds? Or why are you sitting there going like, or just saying like absolutely like questionable things. And it's going to be painful and it's unpleasant, and no one likes watching like the recording of themselves back. But the pain really does make you aware of those things that you do that you're like, I should really stop doing that. And you never do them again because the whole thing is just a little bit traumatic. So well worth doing. It also is kind of nice because if you do one at the beginning and you do one at the end, you can kind of see how far you've come with your practice, and it's nice. But yeah, if you hate the sound of your own voice, it's just going to be not a fun exercise. And another thing as well, which is a really, really good one, is that it's really tempting to approach this process as a hyper-competitive thing where you need to look out for yourself and you need to go at it alone. But I practice for GAMSAT with my best friend from undergrad who's now at Melbourne. I practiced for interviews with 2 other people who were both applying in the same intake as me. And it's really important to view these people not as your competition, but as resources for you, because they're just as motivated as you are to do well in this. And if they're people who are like nice people who you trust to give you good feedback, that's the best thing that you can do for yourself. And like in my friend who I studied with studied for GAMSAT with, is at Melbourne doing med. The 2 people who I practice interview with are both in my year at UCID, like it is true that you're all competing for the same spots, but at the same time, like you're all helping each other out to the same extent. So find people who are applying in your cohort and like make the most of that. I don't really rate the mirror because again, it's just like a watered down version of recording yourself, and you need someone to give you feedback and be like, well, I actually thought about this differently, because everyone has different life experiences. Everyone has different values and worldviews. And it's really important to get those different worldviews to make sure that you aren't being influenced too much by your like own inherent biases or your own like cultural values or whatever. And you want to like make sure that you can consider things properly. The other thing to do is to do a dress rehearsal. So I didn't do like a proper dress rehearsal. I just picked out my outfit and sat around and was like, yeah, this is comfy. The one thing that I do recommend is finding out where your interview is before you go. If you are like, because they're online, it's not really as relevant. So the thing that I would do would be to set up your interview space as best you can. And plan what to say when you don't know what to say. That's always a good one, because sometimes you'll finish stations early and it'll be really awkward because you're both just sitting there kind of staring at each other and you're like sitting and smiling, trying to be like, hee hee, I'm so friendly. But really, like you and the examiner are both hating it. And that's normal. And it's so tempting to be like, but I would like to add this, or I'm just going to keep talking. Like, just don't keep talking. If you've done enough practice, you'll know that you only have like a minute to 30 seconds left. If your examiner's really nice, they'll be like, what about the weather? But most of the time they'll just sit there, and it's okay to become like comfortable with that silence, because like you don't want to then just say random stuff that's going to pull down your score pretty much.
Don't incriminate yourself.
Yeah, exactly. Do you have anything else to add, Mac?
I guess just on the topic of practicing, even like a trusted friend or family member doesn't have to be someone who's like in the med world or trying to get into med that knows the context. Like just asking somebody that you think is like a good person how you sound. And I think don't feel like if you don't know anybody who's doing med or who is in med that you don't have any resources. Like I think it's helpful.
Yeah, I agree with that too.
Yeah. But yeah, that's about it from me, I think.
We might move on to the next slide.
So we're almost done. We just have a link here for some feedback.
Yeah. Fill it out. Help us continue with our growth mindset by saying things that we didn't do well. Help us feel about ourselves by telling us things that we did do well. Be nice. But it's really, really good to get your feedback, because ultimately these sessions are tailored for you. And if you have things that you think should be in there or shouldn't be in there, like we want to know, and we won't necessarily know what you guys want if you don't tell us.
Yeah, like it's all for you. That's the only reason we're here. So
the only person you're helping is yourself.
Yep. And future versions of yourself.
Exactly. Someone told me that when I was filling out a survey last week. And I was like, really? Like, it's a good guilt trip. And then with the next slide, you guys should all apply for this, because it's really like you've got nothing to lose. And getting the attendance course, I think, is better than sometimes doing it online, because you're there, you're engaged. It gives you a little bit more separation between like home environment and learning. And I think it's also good for like meeting people who want to do the same things as you. I've been teaching the chemistry course for the past 3 years, and it's always just like quite a fun week, and people do get a lot out of it. And if you apply for the scholarship, you can do it all for free. So yeah, check that out on our website. But I think unless anyone on Facebook has any last minute questions, we might leave it there for today. But yeah. I hope you guys got a lot out of this. Yeah. Thanks, Mac. Do you have anything else to add?
Charlotte. No, it's good. Best of luck to everybody. I hope you get those interview offers, and I hope they go well.
Yeah, good luck. Don't stare at your little cameras on Zoom too much.
Yeah.
But you'll all be fine. And yeah, it'll be okay. You just need to trust in the process and do the prep.
And enjoy.
Yeah.
Yeah, as best you can.
Yeah. Good luck. Bye.
Bye.